support staff. Now, I would like to ask Dr. Anand that you are running the geriatric clinic. Now, what are the best practices you have seen? And also, there is a question from the participant that can also be taken care of by you, where she asked that, 1 minute, I'll just tell you. The question is about what are the, how can intersectionality, medical knowledge and experience of doctors affect the healthcare delivery to elders? If you can take care of this question also in your presentation. Thank you. Yes.
Like to congratulate the first two speakers for the wonderful insight. Am I audible?
Yeah, yes.
It's a wonderful insight that has been shown, all these the experiences and the evidence and the literature that has been written. Now, I being from the medical background, I will be bringing the real picture of how the elderly women are being taken care and being treated in the hospitals and how their behavior matters. Now, respected chairperson and all the respected faculties, very good evening to all. I just thanks the organizers for giving this opportunity. I bring greetings to you from Geriatric Clinic, wherein we provide services to the older people every Wednesday. And what is important thing I want to highlight here is now we are reaching the older people at the village level. So every month we have got to one village. I have adopted one village wherein we provide healthcare services, screening services, and awareness talks for the senior citizens. And what has been found till now is 70% are women attending these camps. Only 30% are men. Now, I'm informing you here is when we reach the older person, they are very happy that the health services have come to their doorstep. And second is that every time we leave the venue, the ladies ask, "Are you coming for next month?" So this is how the insecure feeling of the older woman in the villages is seen. So I just like to quote Malander: "An aging society is evolving, which for the most part is a female." So I think you all agree. So woman is the best care provider and least receiver of care. That is what has been highlighted. And from my experience in the medical field, I just like to inform that it's the family members who decide the course of the treatment and not the doctor. We make a diagnosis, we tell them what needs to be done. And even in case of emergencies, we tell them she needs admission and she will be treated immediately. It is again the family members who discuss and they talk to their other members who are out of city or out of country, and then they decide. So most of the time, the doctor cannot take a decision because as far as the treatment is concerned, most of the time it is the family members who says, "Now you start." And as far as woman is concerned, we see she spending her time taking care of her husband in the hospital, their children, and for them sacrifice has become a rule. Second important point, what I seen in the providing the care for women is the woman with pension. She receives the best care from the family. Okay, so though she may be rich, they don't get much care. But those who have a pension, the older people's women's family members, they keep coming and requesting ensure that she survives, because on her pension the whole family runs. Okay, and despite all these things, as the previous faculty said about ageism, yes, it is there in all the areas where the older woman or elderly visits. So I had an opportunity to publish an chapter on elder women's health way back in 2013. Thanks to Dr. PKB Nair from Cochin, Trivandrum, sorry, where we had published an chapter and we were studying about the health prospects of the older women. And I just like to share a brief view of what all we have come across as far as women is concerned. So what was my question was why women reach the health facilities late. Of course, financial constraints, as has been mentioned. Most of them are staying alone. They don't have anyone. So they had to wait for the caregiver or the daughter or the son coming from other place and then shift to the hospital. And being widow is again a factor that makes them to assess the healthcare very late. And comorbid conditions like osteoarthritis of the knee, stroke, blindness, especially in the rural women. So they avoid going to the hospitals because they cannot walk or they cannot even climb the bus steps. So they cannot move around. So they are totally dependent upon some healthcare to reach their village. And of course, children's, they ignore them for their medical attention. If a child cries, within 1 hour, he is with a pediatrician. If the old lady cries, chalta hai, kal dekhenge, aaj time nahi hai. So that is how the concept is taking place now. So most of the time we see the older woman is brought late, whereas even the old man is brought early to the hospital. And women are also smart. So initially, if they have a problem, they start using the drugs, the non-allopathic drugs, or they get the drugs from the medical store and they start using it. And of course, some people, they use the drugs meant for the spouse, and they owe the disease to old age. Even if they are feeling very weak, or the old lady, she had a fall, she will not inform the family for at least first 2 days till the pain she cannot tolerate. Okay, so they say that it is because of old age I had a fall. Now appetite is reduced because of old age. So this is how the elderly woman has a concept. And most importantly, when we ask the lady why we are coming late, she says, I don't want to burden my son's pocket. So this is how the sacrifice the women are doing just to keep their children happy. So what are the common medico-social issues that we come across apart from these non-communicable diseases that we have? Not only the diseases, their complications, diabetes leading to blindness, still we are getting. Diabetes leading to cataract, yes, we are still getting. And fractures of femur bone where cannot be operated. And that is the last time she has seen the hospital. She will be bedridden in the home, and whatever care the family members could afford, they provide for her. Incontinence is another important issue in women, which she hides, and because of which she becomes socially isolated. She doesn't want to be among the friends, or she becomes socially isolated. That leads to loneliness and so many issues in the home. And most importantly, malignancies like cancer of the breast and the cancer of the uterus are very common in women. Again, most of the time they don't receive the complete treatment. Depression, loneliness, and self-harm are very, very common in elderly women. So in our study, which we published recently, we found that 30% of our study population were females who had attempted suicide, or they harmed themselves just to end their life, not able to sustain the abuse that they have been in the home. And widowhood, again, as is been discussed, and abuse and neglect are very, very commonly seen nowadays. We are getting older women, especially in emergency departments, for hypoglycemia because they are not fed properly, and though they take the drugs for diabetes and they are not fed properly, they'll end up with hypoglycemia. So what matters again for the women's health is that tobacco chewing. It is very, very common practice by the women in India, especially in the rural setup, consuming tobacco. And why you are eating tobacco? Just because they say that I have got a toothache, so that's what I'm using. So that is the reason just to eat that, chew the tobacco. And that leads to hypertension, malignancies, and heart attacks in the older women as well. So that it is most of the time it is the behavior issues that it brings to the woman. And this is a common scenario which I see whenever I go for a senior citizen forums where men dominance. So I keep telling the organizers that let the man come with his wife, accompanied by his wife, so that she also understands what's happening, and the awareness talks she can even attend and learn something about this. Now, to overcome all those things, we at our hospital and the medical college, we conduct such health checkup camps exclusively for women. So this is what we have been doing, and we are trying to screen them for diabetes, hypertension. They are usually from the BPL strata, the lower income places, and more number of them come attend. And there we also give an awareness talk for them and screen them for diseases. The most important thing that what we have seen in our practice is these elderly women are subjected to the very heroic act, like they undergo brandings. This is what the lady you are seeing having the branding marks. She has, because she had a pain, she has a headache. So she was taken to the faith healer, who with the burning rod had given punches all over the face. And after 2 days, she had come to us. She was in shock, sepsis, and on the 4th day we lost her. So this is how the women are subjected initially, for then from the faith healer, then the non-medical, then they come to the medicine. This is what happens. This is again a very typical scenario which we come across in clinical practice. Is this lady who is seen here is 90 years and her husband is 100 years old, and every time she comes for the follow-up with her husband, she always tells, ensure that my husband still lives long. So that is the only prayer that she is afraid of being widow. That is what she had in mind when I asked you, why is that you are 100 years old and you are 90? So she is afraid of being widow. So that is what she keeps praying me, that let my husband live longer. And coming to the caregiver issues, what we come across in clinical scenario, this is a lady, again, a blind. She is totally blind because of diabetes, and her daughter, she stays in other place, but for just to bring her to the follow-up, so she comes from her place, husband place, and she takes care of, brings to the hospital and provides the care. This is another lady, what we call a sandwich generation, if I am right. She's a 80-year-old lady being taken care by 65-year-old daughter. So this lady, again, she has become blind because of diabetes. Her son refused for surgeries to be done, and her sister, her daughter comes, she is 65-year-old, and she comes, takes her to the hospital and provides health services. So this is how the scenario for older women is taking place. And also the boys are taking, nowadays, this is what I'm seeing. This is just photograph just clicked recently in my hospital, where the caregiver is a man, the son. So daughter-in-law is not ready to come. In such scenarios, we have seen n number of scenarios where an old lady, when is admitted, it's the son who keeps be with them for the long time, and daughter-in-laws or daughters, they try to avoid coming in such scenarios when they are critical. This is a lady, again, she was very critical. I just closed the eyes. I wanted you to see this because she had tears. Whenever I used to go and talk to her, she had tears. She wanted to say something. Okay, she wanted to convey something. So I just removed the oxygen mask for a few minutes, and I just listened to her. What is that she wants? So these are the issues they try to convey. Though they can't force, but they are trying to convey, and it is the doctors who should understand this, that this lady wants to convey. This is an old lady whom we visit her home. Yeah.
Sorry to interrupt. Are you sharing the screen?
Yes.
We are not able to see. You can go to the share screen.
Fine.
Between the Zoom.
Fine. Oh, sorry.
You can, yes. You can slowly revisit the ones we missed, no issues.
No, I think I will go a little faster, then no issues. Okay, so this is what I was telling you, the lady and the caregivers, where sandwich generation and this takes place. And this is a photograph I showed, just showing you that this taken care by sons. The daughter-in-law don't want to come to the hospital. So this is what happens in, and this is a lady who wanted to convey us something. She is on ventilator, and she was on many machines. When we go and said, she was literally had tears in her eyes, and we just listened to her and tried to reduce all the interventions in her, and we could give her even a good death, a dignified death, what we call for her. And this is an old lady. She keeps visiting her. She's alone, living with her daughter. Both are widow. She is also widow. Her daughter is also widow. So the lady, her daughter goes to the work in the morning 8 o'clock and comes back to the home in the evening 6. And till then she stays alone in a hut and with nobody to support her. So we provide her health services to her doorstep because she is also disabled. She is differently abled. And we are now coming across a lot of females to have a posthumous body donation. So this is a lady teacher. She has donated her body posthumous. So we at our geriatric clinic also promote those who want to donate their body after death, they can register themselves, and this is the ladies are coming forward to that. And the most very important thing what we get from a doctor's point of view is whenever a mother is saved, after a few weeks, their children come and greet us, and even this is to the extent that they honored me for saving their mother's life. So how the importance of their mother in their family is been emphasized here. And this is how, again, an old lady who cannot walk properly, she comes as support. This is again at the village level, where they keep requesting us, please do come every month, because I cannot climb the bus or come to your place. So if you come to my place, I'll be very helpful and thankful. So this is how these are older women are facing issues from the health prospect point of the view. So our concept of providing health to the elderly woman is to reach the unreached. That is what we are doing, through which we ensure that the health services are reached to the woman every month, and the drugs are provided, and screening for hypertension and blood diabetes are done properly, and even for cataract surgeries. And every woman should be provided opportunity and responsibilities. That is what it has been discussed by the previous speakers. And the most important thing which hurt me is one woman is neglected by another woman. So it is again the daughter-in-law, daughter who is not ready to take care of her mother-in-law or mother. So that is how we are looking for the society. And we should provide a secured environment for the people, for the best care provider. Woman is the best care provider, and she, especially the Indian woman, providing the care for the family, keeping the environmental, the cultural factor, and the financial factors in mind, and though she is not expecting anything from the return. So, from the doctor's point of view, their well-being and quality of life should be a priority. Of course, we should look forward for the dignified death. We are practicing here end-of-life care issues, and we try to give them a dignified death in the hospital. And we always respect their views. When a woman, when we write a prescription paper for 1 month, the woman politely says, write for 2 months. If you write for 2 months, my son will purchase for 1 month. So this is how the concepts are coming. As far as clinicians or medical practice, geriatric practice concerned, doctors should be sensitized when we look at the older people, because most of the time they are trying to convey something to us. We have to look into their eyes, and we should listen what has been not told. And older women always look for the privacy in the clinic. In my clinic, when the children or the daughter-in-law goes out to bring the drugs, then she comes in again and she shares her domestic issues, what all happening in her home. And she takes one promise, don't tell to my children. This is what is happening. So this is how the women are facing a lot of issues in their own home. Most of the times they are not getting the food in the proper time. Most of the older women diabetic, their sugar levels are not controlled, and I cannot scold them. Then she politely says, my daughter-in-law gets up at 10 and provides me the morning breakfast at 12 o'clock. Then how can you expect me to have a blood sugars under control? So these are the issues. That's what I just mentioned, that woman neglected by another woman. Maybe I may be a little harsh in this, but this is what we are seeing in the scenario what we are coming across. So I thank you for giving me this opportunity. And of course, the older woman is the power. This is a very nice photograph I had taken long back. She is a 90-year-old going for voting, and they can, if they wish, they can make a change and put the policy makers at their knee. But there is no eminence of women felt across India. So maybe that is lost. So I just recommend those who are interested to know, there is one literature brought by WHO, Women, Aging and Health, and there's a beautiful book and has been given solutions also to many of the problems that the older woman faces. So with this, I thank you all for your patience, and thank you. And I'd like to take some questions for discussion also.
Yeah. Thank you, Dr. Anand, for bringing out a very important ground level reality, very heart-rending reality, and also highlighting the medico-social issues and also some of the important things which we all have gone through, especially the sandwich generation, all of us have been, who are in our late 60s and looking after the elderly people. The most important message from your intervention is that the listening to the silences, because the powerlessness of elderly women, which you have brought out so succinctly and around